Excited to introduce you guys to the webinar that's going to be happening today. It is going to be about shin pain, and it will be presented to you by Lindsay Smith and Radhi Kadakia, who are physical therapists at C7 Street. Stay tuned, and they'll be coming to you for that webinar.
Hi guys, Lindsay and I appreciate you all attending our webinar this evening. We are so excited to discuss a topic about different types of shin pains that commonly occur, especially during the summer as you travel abroad or even pick up recreational activities as a pastime. This webinar will educate you on some pathologies on the shin, such as medial tibial stress syndromes, more commonly known as shin splints, compartmental stress syndrome, and tibial stress fractures. We'll also prepare you to tolerate and manage some of these symptoms. Just as a quick disclaimer, the contents of this webinar should not be taken as a strict medical advice or a how-to guide. If you're injured, we definitely recommend you seek out medical attention from a licensed healthcare professional. So, as you can see from the next slide, before we dive into different types of injuries, I wanted to run through a brief overview of the anatomy of the lower leg. There are multiple compartments: the anterior, lateral, superficial, posterior, and deep posterior compartment. Each of them contain different nerves, veins, blood vessels, and muscles. All of the surrounding tissues in the lower leg work together so that we're able to move and groove as we please. As you can see in the photo, there are two bones in the lower leg, the tibia and the fibula. Both bones are surrounded by periosteum, which is a thin membrane layer. Along with this, there are various ligaments and muscles that originate and insert onto the bone. So realistically, the bone in our lower legs carry a lot of weight, and it's important to keep them extremely healthy.
So in our first slide about the diagnoses, we'll be talking about medial tibial stress syndrome, otherly known as shin splints. This type of shin pain is going to be pain that's located on the middle portion of the lower leg of the shin bone. This is common with runners, dancers, military personnel. It can also occur with non-athletes as well. It's just more common with athletic populations and runners. So this pain will present as diffuse pain, so not focal, not one spot, but more of a broader region of pain. And it'll be located on that middle side of the lower shins. It'll also be tender to palpation. So if you can put your finger along that middle side of the lower leg of your shin, it should be a little bit tender to touch. And that could occur for up to hours or days after the aggravating activity. The cause is a little bit more unknown, and it is likely due to errors in training. So typically too much volume, duration, or frequency of training. Anytime you've kind of upscaled your activity to do more in a quicker manner, that's usually when we experience this middle tibial pain syndrome, and usually takes longer than patients would like to hear. So it takes about 9 to 12 months for people to find complete relief, and that's what the research is demonstrating. However, there are exercises that you can do to help it along, as well as small incremental amounts of increase in exercise volume. So doing a little bit at a time within your pain tolerance, nothing more than 2 out of 10 pain with activity. And on the next slide, this slide is talking a little bit more about load management. So going to a physical therapist, talking about the proper dosage of exercise is really important to get rid of this shin pain in the long term and take care of it before it stays a chronic condition or becomes aggravated to the point where you can't get those symptoms to come down. So going to a physical therapist, talking about strengthening exercises for the lower legs, stretching exercise, and also load management. So doing what your body can withstand. You want to decrease your aggravating activity, at least for a little bit, to get those symptoms down, and then improve lower extremity strength. And surgery is typically not recommended for this condition. It's not shown to be beneficial in any way. An MRI can be performed to determine if there is any type of bone stress injury, which is often associated with this condition, but it can occur alone without that stress injury of the bone. And this slide is a little bit of a breakdown of the history, what you'll find, kind of already what I talked about of what you'll find, what the physical therapist would find in your physical examination to diagnose, and then imaging if we feel that there is any type of stress to that bone or any type of stress reaction, and then treatment, which is mainly conservative, which is great because you can go to a PT and not have to get any type of less conservative care and with surgery and things like that. The next very common cause of shin pain is called chronic exertional compartment syndrome, or CESC. This can present very similarly. All these shin pain diagnoses really come on with activity and are relieved with rest. So that's why it's kind of tricky in diagnosing, but that's why it's really important to see a physical therapist to make that diagnosis so that they can give you the proper plan of care and treatment plan. Chronic exertional compartment syndrome also occurs with athletes, but can occur with non-athletes. And it often presents both legs, whereas the medial tibial stress syndrome can affect one leg. This will affect both legs, and the difference is that there's no tenderness to palpation. So if you're touching along that middle side of your tibia or your shin, it shouldn't be too painful. Pain can be located in multiple areas of the calves. Radhi was talking about those 4 compartments. It can affect any of those compartments, so it kind of can move around more. And you might feel cramping, burning, pressure-like calf pain. Sometimes people will have nerve-like sensations because there's pressure around the nerves. So, for example, pins and needles, and maybe a cold foot with exercise. The cause is increased pressure in the compartments of the leg. I would still see a physical therapist to make these diagnoses, but this is responds a little bit differently than the other one to conservative care and management. And this is kind of just what I was talking about, a little table of some of the facts of what you'll find on the examination, what you're going to feel with activity, and then diagnosis and treatment options.
Okay, so there can be many different types of stress fractures. It can happen to any bone realistically, but the only difference from a regular fracture and a stress fracture is that it's usually a repetitive motion causing the break. These fractures can be treated surgically or non-surgically. It just depends on the severity of it. For this presentation, I will be speaking about tibial stress fractures. And just a preface before the presentation, if you have a fracture or you think you might have one, please immediately seek medical advice and do not try to remedy the situation on its own, because that can lead to much worse of complications. A tibial stress fracture can often occur after a continuation of having medial tibial stress syndrome and left untreated. There are many risk factors for this. So some of them are high impact sports players. So if you run track, play basketball, tennis, dance, gymnastics, anything with high impact. Military recruits who usually have to lift heavy weights on their back for long distances. Females, especially those who have abnormal menstrual cycles, are at a higher risk because of the hormone levels. Having a past medical history of stress fractures can also lead you to having more reoccurrences of this. Osteoporosis, people who have flat feet or arched feet, poor running form, poor blood supply, and also improper footwear. And then the last one is living a sedentary lifestyle and then suddenly switching to a super active regimen. Everything has to be done gradually. Some causes for stress fractures, basically they occur from increasing the amount of intensity of the activity. So if you're feeling pain not only with the activity but also at rest, there's a chance that your shin splint has now led to a stress fracture. Muscle strength can also play a huge role in creating stress fractures. The neuromuscular hypothesis explains that neuromuscular function throughout the muscle can help reduce the impact applied on the bone and joints during high impact activity. So if the muscle is fatiguing or atrophying, it's unable to absorb the energy of the external load, and it'll result in a higher stress to the bone. To continue on with this topic, the body is like a kinetic chain. So the lower extremity consists of the hip, knee, and ankle, which all work together in order for us to function. So having an injury to the ankle can likely lead to instability to another joint. No matter what the injury is, it's important to address the linked joint in that kinetic chain, and that oftentimes can play a role in the injury. And then a last cause that's more correlated to women is the female triad. It's known to be correlated to increased chances of stress fractures because of menstrual irregularity, low calorie intake, and that's because of the hormone production being less and decreased bone mineral density. Chain. So the lower extremity consists of the hip, knee, and ankle, which all work together in order for us to function. So having an injury to the ankle can likely lead to instability to another joint. No matter what the injury is, it's important to address the linked joint in that kinetic chain, and that oftentimes can play a role in the injury. And then a last cause that's more correlated to women is the female triad. It's known to be correlated to increased chances of stress fractures because of menstrual irregularity, low calorie intake, and that's because of the hormone production being less and decreased bone mineral density. So some exam findings for stress fractures can be a tuning fork test, a single leg hop test, and feeling pain, warmth, and focal tenderness around the tibia, the anterior aspect. It should be less than 5 centimeters of a region where there's actual tenderness. And then the gold standard for identifying stress fractures are the MRIs and X-rays.
So we're going to show you guys a few exercises that you can do at home before starting to see a physical therapist to manage your shin pain. If you are having a stress fracture, like Radhi talked about, that's important to go see a physician to get an X-ray or MRI to confirm that there is no bony injury to your tibia. But if it's the other two conditions that we talked about, you are welcome to try these exercises at home as long as they are not uncomfortable or increasing your pain or aggravating your symptoms. So we're going to start by showing you guys a few exercises. The first one's going to be a calf stretch, which I'm sure many of you have done in gym class or any type of classes that you've taken with activity. There's two types of calf stretches that we're going to show you. One is a straight knee calf stretch and one is a bent knee calf stretch. So I'm going to turn around and show you guys which ones we're going to do first. Generally, these calf stretches can be held for 30 seconds and done 2 to 3 times to really get the full effect. The first one is going to be called a gastroc calf stretch, and that's the one where your knee is straight. So you are going to face a wall. The leg that's being stretched is going to be the one that's back, and you are going to keep your back foot down on the ground, keep your heel on the ground, lean in towards the wall until you start to feel a nice stretch down the back of the calf, and you are going to lean into that wall until you feel that stretch. And then once you feel the stretch in that back leg, you're going to hold it for 30 seconds, and then you can take a break. And since it's likely that you have a little bit of calf tightness on both sides, you're welcome to switch sides, do 30-30 on each, and do it a couple of times. The second calf stretch is going to be the bent knee calf stretch, and that is going to be the soleus stretch. So for that one, the front knee is actually going to be the one that's being stretched. So just to show you guys from the side, you are going to be, the front leg is going to be the one that's being stretched. You are going to keep the whole foot down on the ground, including the heel, and you're going to bend the knee in towards the wall until you feel the stretch behind your calf. That should feel a little bit different than the previous calf stretch. So you'll feel those two in 2 different places, and that's going to help alleviate some of that tightness in your calf that's likely causing some of that shin pain that you're experiencing.
And then, so once you're all stretched out and you're feeling good, it's also time to strengthen. When you do when you have shin splints, medial tibial stress syndrome, you want to make sure that you're also strengthening the muscle that's probably being atrophied. So after doing the stretches, the next one that's really good to do and very easy at home is called a heel raise, which is more commonly known as tippy toes. So you literally will just bend up, and I like to hold for 5 seconds. 5, 4, 3, 2, 1, and bring it back down. You can do it both legs. Definitely do it on the leg that's being affected, but I like to do about 30 and hold them for 5 seconds in that up high position.
And if you want to see what that looks like on a wall, if you're doing one leg, you might have some difficulty with balance. So if you hold onto a wall and bring your heel up like this, that can be a good way to progress from double leg to single leg. So you're going up on your big toe and then slowly coming down. It should never be quick. It should be, the whole motion going up should be slow, and then also the down should be slow and controlled as you're doing it. And these, because this is a strengthening exercise of the calf, this can be done in, typically we'll say 3 sets of 10, but you should really be doing every set to fatigue. So whether that's 6 repetitions, 12 repetitions, you should feel fatigued by the end of your set to the point that you need a rest, take a break, do 3 sets of it.
Another one that's really good to address medial tibial stress syndrome is something called a heel walk. So with the heel walk, you're pretty much doing exactly what it says. You're walking on your heels, and it's to help with stability, and it's also to help with stretching out the muscle that's in the back of your calf at the same time. And then with toe walking, it's something, well, I'll let you take over that part.
So the toe walking is going to be strengthening the muscles in the back of the calf, whereas the heel walking is strengthening the muscles in the front of the calf. So there's muscles that run along here and then muscles that run along here. Essentially with any type of runners, these muscles are often weaker and greater muscle groups will try to take over. So it's really important to strengthen the full area around the calf. So the calf muscles and the anterior shin muscles right here. So those are going to address both, and we'll show you guys how to do those in the hallway. Thank you guys so much for joining us. It's been a pleasure to talk about this topic that we're so interested in. We'd love to hear your questions afterwards regarding your shin pain or any questions you have about the information we've discussed today. My name is Lindsay.
My name is Radhi.
We work at Spear 57th Street. We would love to have you guys if you feel like you are experiencing shin pain, you are trying to get back to something you love to do, whether that be running, walking, training for a marathon, a triathlon, whatever it is. We love to work with athletes. We love to get you back to doing what you love to do. And we can't wait to hear your questions, and we hope to see you in the clinic soon.
Come visit us.
Hi guys, it's Lindsay.
Hi, it's Radhi.
Nice to see you guys live in person. We're here to answer some questions that we received from some patients, some people who are interested in the shin pain video. So we're here to answer some of those questions now.
And just really quick, before we begin the Q&A session, just wanted to go over one more thing about the video that we had recorded previously. So when I was talking about the body being a kinetic chain, where the hip, the knee, and the ankle is all correlated together. Also, through research, we found that the big toe is also related. So sometimes shin pain can also be referred and can also occur because of some sort of big toe concern. So the flexor hallucis longus, the muscle, a lot of times if that's impinged, that can lead to difficulty climbing stairs, running, and walking. So it's really good to make sure that we take care of every single joint whenever we're having issues with one section. All right, Lindsay, let's start this.
Let's do it.
So the first question, Lindsay, can the wrong shoes be the source of shin pain?
Yeah, so we hear this question a lot in the clinic, asking what kind of shoes people should get, if it affects their shin pain, knee pain, foot pain, all the type of pains that people experience with walking, long distance walking and running. A lot of the times, shoe pain, a change in shoes can make a difference and help with shin pain. So if you are wearing shoes that are really run down, that have possibly exceeded the number of miles that you're supposed to put on a pair of sneakers, then that can really affect the whole kinematic chain, like Radhi was saying, of where the stress is being placed on the lower extremity. So I would really recommend investing in a new pair of shoes, getting inserts. There are certain inserts that can be put into the shoes that support the arch, and having a support arch can prevent that pronation or that collapsing of the arch when you're running that puts forces and stresses into the shin that could be causing your shin pain. So if you've been wearing the same shoes for a long time, I would try changing up your shoes in addition to all the exercises and strengthening and those things to kind of get a full picture of how can we change what's currently the stress that's going through the leg and try to alter some of those forces. The next question we have, Radhi is going to answer. Can compression socks help with pain?
All right, so this one is a little bit more, it's a little bit difficult to say a yes or no to this. It can provide relief for sure to the shin. You have some sort of support around the area. So when you're walking, when you're running, going upstairs, you might feel like you're supported. It may or may not help. It's something that you can use if it feels good for you. And then if it doesn't really do much, then you don't have to use it. So that's just one of those up in the air ones. All right, Lindsay, can a shin massage help the pain?
Yeah, so a lot of when you go to a physical therapist for shin pain, some of it might be soft tissue treatment or a massage to those anterior shin muscles, possibly posterior, so in the back of the calf. It can help temporarily, but in the long term, when you're running or walking and having pain through that shin, it's likely more of a muscular control issue. So strengthening, making sure that you have the supported arch, either from an insert, both from an insert and from just muscular strength of your arch and foot. That's going to be the most important part to healing your shin pain. Making sure you're doing your strengthening exercises, your stretching of your calves, that's going to be more important than soft tissue. However, in the short term, it can provide some short-term pain relief with some massage or soft tissue to the shin.
Yeah. Okay, so the next question we have is, without fail, after a long session, my mid-posterior shin starts to tighten, stepping down and up the stairs. What steps can I take to prevent this issue from happening and staying strong throughout the season? So some of the stuff that we were going over today in that video actually would be extremely beneficial. If you start feeling some sort of tightness when you go up and down the stairs, that's a really big indication to start stretching the muscles. So it was demonstrated before to do the stretches against the wall with your knee straight and also with your knee bent. Those are the best things to do at least 3 times a day. Just making sure you're consistent with those is a really good way to prevent feeling some sort of tightness. Lindsay, next question. Someone from the chat. Exercise recommendations for the following. Left knee was really acting up in my Zumba and workout class. I had to dead stop classes. So I guess some exercises.
Yeah, I mean, if you're starting to have knee pain, I would definitely hold off on any activity that's exacerbating your knee pain. And I would go and see a physical therapist. Unfortunately, we can't there's no like cure all for these exercises. We try to individualize it to the person, give a individualized patient-centered approach. So it's hard to say exactly what exercises you need specifically for your knee. If it continues to interfere with your daily activity, prevent you from doing certain classes, I would definitely advise seeing a physical therapist and trying to get the root cause of why you're having this knee pain. Because like we talked about previously, adjacent joints can be affecting the knee, not just what's going on in the knee, but the hip, the ankle, the foot. It can all affect different body parts. So it's important to go to a movement specialist, like a physical therapist, to get that taken a look at.
Yeah, and the last one is it useful to wear a calf sleeve? So that's very similar to compression socks. They're not the same thing at all. They're just the idea for the shin pain is a very similar thing. It's just one of those, if it feels good for you, you're more than welcome to wear it. If it provides you relief if you're walking all day, go for it. If it doesn't help you, then it's also okay to not wear one and to just continue doing different exercises and activities that we talked about and visiting your local physical therapist to get treatment. But it's definitely not a cure. All right.
So I think that concludes today's session. Thank you guys so much for your questions. We appreciate any feedback that you have as well. And we hope you enjoyed and learned something from our lecture today.
Yeah. Thank you guys. Bye.